Well, hello.
Hi.
We're so excited.
Me too.
I'm going to just go through your bio, if that's okay.
Fantastic.
So that everyone can get to know you. Dr. Sarah Oreck is a Columbia University trained and board certified psychiatrist with a fellowship in reproductive psychiatry and is the co-founder and CEO of Mavida Health. Driven by a deep frustration with the shortcomings in women's health, Dr. Oreck envisioned Mavida Health as a platform to revolutionize access to high-quality mental health services. As a practicing therapist and prescriber, she combines cutting-edge medical treatments with a holistic, whole-body approach to mental health. She is the daughter of South American immigrants and grew up between LA and Colombia. She currently lives in LA with her husband and 3 children.
And dog.
And dog.
Can't forget.
Can't forget. That's like, yes, always. Okay, cool. Well, how are you today?
I'm great.
How's New York?
It's nice to be back.
Yes.
Wish it wasn't as cold.
Nice. What is, I guess you're in LA now, and there's
Yes.
kind of always that LA, New York.
I know.
What are the things that you miss? What are the things that you love?
I miss the bagels and the pizza here. There's just no comparison.
Mm-hmm.
It's the water. I'm unclear what the issue is, but the bagels cannot be duplicated. And like the whole feeling, I think there's like a vibrancy to New York that everyone's just so compact.
Mm-hmm.
But Los Angeles, it's weird. It gets you. You get stuck there. There's something about its funkiness that you're like, I can't leave this.
Yeah.
And I'm from LA, so
Okay.
you know who's gonna win.
Feels like going home.
Yeah.
Nice.
LA's the winner in my book.
Cool. All right. Well, we asked our users to submit questions on Instagram
Love it.
a few weeks ago. So we're kind of going to go through those today. But yeah, and obviously if it goes other places.
Let's do it.
Before we get into that, though, I do know you are a Natural Cycles user.
Yes.
Do you have a favorite feature?
I think the privacy features are like where it's at for me. I think this is a really weird time in our kind of government and how women are feeling about their bodily autonomy. So it's really cool to have NC Secure and really like be able to like at a moment's notice change that feature, de-identify your information and data. Like I think that's really exciting.
Yeah. No, it's definitely something that's really important. So to kick things off, I would say the questions are definitely going to be focused on postpartum, mental health.
Yep.
So we had someone ask, what causes postpartum depression? And then why are some women maybe more susceptible to it than others?
That's a fantastic question. So it's complicated, like most things in medicine. What we think is happening is that some women are more acutely sensitive to the huge drop in hormones that happens during their pregnancy and in the postpartum. So during your pregnancy, your progesterone, your estrogen, and some other hormones are basically reaching heights they've never reached in your life. And then all of a sudden you deliver the baby and they plummet. For some people, that's not a big deal, but for others, that shift is so tremendous that we think something is set off and their resilience probably isn't as strong because of the other stressors. And what are the other stressors? You're probably maybe not sleeping. Your whole life is changing in front of you. Relationships may be strained. There may be financial stressors. And all of these things on top of one another, together with that huge hormonal shift, is why we think postpartum depression and actually anxiety may happen.
Okay.
But for some people, there's so many other factors. If they've had mental health issues in the past, they're at higher risk. If they did IVF or had difficulty with fertility, they may be at risk. Or if they had any symptoms during pregnancy. So the short answer, it's multifactorial, but we do think that there's a strong hormonal underpinning to it.
Okay. And is it, how, I guess, what's the timeline when that shift happens? Is it immediate? Is it?
Yeah, so it is, for some people, it is pretty immediate. And what we call baby blues actually happens to 85% of people who deliver. And that means in the first 2 weeks, they have like these big fluctuations in hormones. One moment you're like, I'm so joyful. The next is like, I have no idea why I'm crying.
Yeah.
And this happens to 85% of people who give birth. So it's a big percentage. But when it starts to persist longer than 2 weeks, so we're going into 3-4 weeks, and there's difficulty functioning, or if there are ever thoughts of, I don't want to be alive, or I maybe shouldn't be this baby's mom, that's when we think something else is going on and postpartum depression may be happening. But I want to be clear, postpartum depression doesn't always happen immediately for people. For some people, it comes up later in their postpartum. Sometimes it's during weaning from breastfeeding. So it's not totally linear. And like, even if you don't get it in the first month, that doesn't mean that you're totally out of the woods.
Okay. And with IVF and different hormonal treatments,
yes,
I guess, I know you said that can kind of impact that. Is it kind of similar in the way that we think of getting off, let's say, the birth control pill and how there's that kind of in-between period? Obviously, this is a different case scenario.
It is, but in some ways, how people react to hormones is very individual. I may react totally differently than you do. And I think we've gaslit women into saying, oh, no, it's nothing. You shouldn't feel that way. But we do. We all feel different. Some people get very bloated during IVF treatment. Some people have very extreme mood symptoms. And so all of those things can add up. But the stressors with IVF is the cost, the fact that you have to do it.
Yeah.
It's a lot of mental load to do all the shots, to, in some ways, like, hold your breath for this baby that you want to have so badly. And I think in some ways there's a lot of grief mixed into IVF. You can't just go home and have sex with your partner and have a baby.
Yeah.
Like, things are really challenging.
And does it matter on the delivery? Does that have an impact?
So
too?
that's a great question. And actually trauma at delivery. So if perhaps you didn't get what you expected or you had a traumatic birth, can definitely increase the risk of postpartum depression.
Preparing to have a baby with fertility.
Yes.
Does sobriety and having kind of more of these healthy habits and speaking to the partner too, not just the women, but is there a direct correlation with conceiving with that? Or?
Listen, I think the evidence base is growing. It's not super strong yet to like you have to do X, Y, and Z. But we certainly know that alcohol and drinking alcohol is tied to egg quality, which we do know ends up resulting in a successful pregnancy and live birth. So certainly, alcohol isn't that beneficial generally.
Yeah.
When we actually start to think about it.
Right.
And so a lot can be gained by not drinking as much, but it can be really hard because it's something that's hardwired into our culture. It's something that definitely increased during the pandemic, especially in women.
Yeah.
Especially in women with children, actually. With young children. Drinking was something that you were able to kind of, you're at home all day. How do I break up this day and kind of signal what's my ritual of like, I'm done with the day? And drinking has become one of those rituals. So I think sober curiosity and sobriety can be really helpful, not just for fertility, but also, men's sperm are becoming an issue and they are a big cause of fertility issues. And we know that sperm quality has decreased over the last few years. And a big kind of factor in that is use of marijuana, actually. And so when there's also decreased use of marijuana and other activities that can decrease sperm quality, we see that there's an improvement in kind of being able to conceive. So yes, healthy lifestyles for everyone, I think, is a good idea. But yes, when trying to conceive, it can be helpful. But listen, this can go really extreme. No plastics, sure, like there are toxins. No, glassware, all this stuff. I think it's be measured in your approaches. And listen, if you cut back smoking or drinking, that's huge. Like the benefits from that are going to be a lot more than like never touching a piece of plastic again in your life. So like, don't be like enslaved by it, because I think it can get really intense of like, I need to eat totally clean and I can't do this and I can't touch this. And that's really hard.
Yeah, I am curious with, because I know online, obviously everybody has that. We've all seen those reels of those insane morning routines. And there was that one that just went viral of the man who got up at, I think it was, 3:30 in the morning or something.
To do what?
The mouth
something
tape,
with a weighted
stick
vest?
his head in a bowl of water, go outside and it was, I wanted to say it was a joke, but I don't think it was.
No, it was probably very serious. Okay.
I went viral because people saw that and luckily received it, I think, the way that we would hope is this isn't realistic for most people.
Yep.
So when you shift, if you've had a little bit of that morning routine and you haven't had kids, how does that impact your mental health? Because you have to, that is gone.
I know. This is why this man was waking up so early. Like, because he had
Possibly.
kids.
It didn't bookend with kids, so I
No,
don't
okay,
know.
fine. But yes, listen, I think it becomes really hard, those rituals, those times. I mean, for me, what I miss the most is just the Saturday or Sunday afternoon where you're just like lounging around, like, what should I do? Should I go out? Should I go shopping? Like, should I go get groceries? I
Yeah.
think those times, and especially those rituals that used to fill you a lot, are really disrupted with children. And so it's figuring out, do I need to wake up a little bit earlier? Hopefully not at 3:30 in the morning.
Yeah.
But what can I do to even include them in these rituals? Or what
Mhm.
can I do to kind of integrate this? If I used to go for a walk to get coffee, why can't they come with me? And I
Yeah.
think that is something I think need to think about, especially in the US, where I feel like a lot of parents kind of think about, okay, what are we going to do for the kids or with the kids, instead of like, how can the kids integrate into what I want to do in my lifestyle and which is, I think, a more European approach. It's like, you're just going to come to errands with me. That's what being a child is like.
Yeah.
But it's really hard to get those rituals. But I wonder if anyone should be doing those types of rituals. If your ritual is more than 2 hours, you should reconsider it.
Yeah. You're setting yourself up for success, but then also to get to do the thing
And
that
I
you need to
think
do.
I think really you can, like, small rituals can actually be really fantastic. Like, for me, something that really cemented, like, I'm through my postpartum is like, now I can actually put makeup on. And listen, if makeup doesn't matter to you, like, don't do it. Who cares?
Right.
But it is like a little bit of self-care. It's a little bit of like a massage. There's these
Yeah.
little times where you can take those kind of minutes to yourself to kind of get a breath that can be so helpful.
To pivot a little bit on the other side, do you have any tips for somebody who's maybe coping with pregnancy loss?
Oh, so hard. I myself had a second trimester loss, and it's been
Wow.
one of the most difficult experiences I've gone through. I think when you first experience it, for me at least, and for some of the patients I've worked with, there was so much like shame of like, what's wrong with my body?
Mm-hmm.
Why can't I do this? Like, I must be defective. And I think it's really important to start to kind of get deeper into that and what's going on there, and then start, if you can, opening up, because this is when everyone comes out and says, oh, I had a loss. Oh, grandma had 5. Your
Yeah.
aunt Susie had 3. And it's like, wait, why doesn't everyone talk about this before it happens?
Yeah.
I think it's very common. And the minute you start to kind of talk about it, people will be there. They have also experienced loss. I think what's really difficult about it is that for the person carrying, whatever you want to call it, whether it's a fetus, an embryo, a baby,
Mm-hmm.
it is really this unique experience. Like, I didn't think anyone in my family could really understand what it was like for me to have the experience. And I felt like I knew that baby more than anyone else did. And that's really hard. And I think it's a time you're in the postpartum. Even if you didn't deliver a live baby, you are still postpartum. Your hormones have increased and now they've decreased.
Mm-hmm.
And that can be really challenging. And so there can be mental health issues. So again, get as much support as you can in your community. And if you can't find it, I think it's sometimes a good point to start therapy.
Yeah. And Mavida Health has
Yes.
a option for that.
Exactly. So my
nice.
company, Mavida Health, is a fantastic organization that does virtual mental health care for exactly these issues.
What resources do you recommend for navigating infertility?
You know what I'm going to say? Mavida Health. I felt like there wasn't that much stuff that existed, frankly.
Mm-hmm.
And we talk a lot about postpartum, which I'm really happy about.
Yeah.
It's so interesting. We even say postpartum, and you knew I meant postpartum depression. But everyone that has a child is postpartum. But it's kind of become this almost like a meaning, but she has postpartum. Like, of course she does. She just had a baby. No,
Right.
she has postpartum. That's postpartum depression. But I think for infertility, it's still something that's in the shadows. Something people are kind of maybe not talking about as much, even though when you are struggling to conceive,
Yeah.
I mean, the rates of anxiety and depression in both couples is over 50%. I mean, I think it's more like 75%. There is tension in the relationship. Why haven't we done this? Why can't we do this? What's wrong with you? Is something wrong with me? It's a really complex situation. And so I think you know, I think evidence-based content around meditations, you know, reading, figuring out what it is that you're experiencing. And what's so hard is that most of the time you get, it's unexplained infertility. Sorry. Like, that's your diagnosis. It's like, what? What does that mean?
Yeah.
And I think that uncertainty is really challenging, but I think it's also a good time to start to do couples treatment, frankly. Yeah. And to really gain some insights into what you're experiencing, how you're experiencing, because this is the kind of stuff that then will come up during pregnancy, will come up in the postpartum. And I think it really sets you up for success to kind of figure out your values during this really challenging time.
And when do you, for infertility, I guess for testing,
yes.
When do you recommend maybe starting that, even if you're, I don't know, do you start 5 years before you even want to conceive, just to be aware of it? Or?
There's conflicting kind of data about this. And I think this is a challenge because I'm a doctor that's like, if I don't know what I'm going to do with the test, I'm not going to do the test. Because if I don't know exactly where to point you or what to do, what's the point of us thinking something? Because it's not a full picture.
Right.
You know, so sometimes people talk about anti-Müllerian hormone, that's AMH, and they're like, this tells me how many eggs I have. Well, that's not the complete picture because it doesn't truly matter how many eggs you have. It's the quality of your eggs. You can have tons of eggs, but none of them can turn into embryos if they're not good quality. And so people take that to mean I must be infertile. This means I'm going to have problems. But actually, it doesn't mean that at all.
Yeah.
And I don't know if you want to carry that for so many years.
Yeah. It's almost like...
It's like almost right, or like the self-fulfilling prophecy. So I struggle with that one. Unless you're going to tell me, oh no, it's because I'm going to freeze my eggs if there is something here. Then I say, oh, then there's a purpose to why you're doing this. But you just want to kind of have this information that's not entirely clear and doesn't correlate to exactly what's going to happen for your fertility. Then I say, don't do it.
Okay. And that would apply to the male, do you think, as well, too?
Yeah, if you, right. But start the healthy lifestyle. And then, I think the recommendation still is, if you're above a certain age, if you're above 40, after 6 months, you should definitely get into a fertility specialist to ask these questions to get the testing because you want to conceive now. And then for people that are younger than 35, not younger than 40, I think it's still 12 months. But you don't have to wait 12 months. You can wait 3 months. You can do whatever you want.
Yeah.
And then say, you know what? I want to see what's going on here. But the preventative stuff is hard unless you're going to do something with those labs.
Yeah. It's maybe not information that you just should sit with.
I mean, from my anxious perspective, I'm like, no thanks. I'm going to skip that one.
That's fair. And then I guess when you're looking for fertility clinics, what are some things that people should be looking for?
This is tough because
now I almost feel like trendy with freezing eggs. I hate to say that, but it seems like I have friends that are barely 30 and they're thinking about freezing their eggs. And I don't know if that's too early, too soon.
No, I mean, in some ways, like freezing your eggs at 20 would be the best age because you're going to have the most viable, like incredible eggs. But I don't know. I don't, some people aren't ready for it. And I agree with you. There's something about that that's not a one size fits all, right? Just like hormonal birth control is not a one size fits all. I think people really need to evaluate their values and also that it's okay to not have children.
Yeah.
That's a really valid choice. So, I don't think everyone should freeze their eggs. That was one. And how do you find a fertility clinic? This one's difficult because sometimes you want to find what's covered by insurance.
Yeah.
And so that may be the first way you go. And a lot of these places are big. You're a number. It's almost like a cattle call. Some of the doctors don't necessarily like recognize you.
Right.
I don't like that type of care, but it's hard. I think for me, it's really trying to connect with a physician that I feel is hearing me, hearing what I want to do and working with me in that way. But I think it's hard to find that if you're like looking for particular things in network.
Yeah.
So I wish that was the case and that you would feel more like an individual. I also wish that there was more asking, like, how are you doing? This is really hard.
Yeah, that's so rare.
Right? Like
in any medical appointment.
Right? But it's like, oh, we just did a retrieval and you didn't have any viable embryos. How are you okay? I know that I wasn't asked that.
No. Now we just open it up an app probably and it
Right.
tells
Or
you.
yeah, I was like, it's in your portal. No, but it was just kind of like,
Yeah.
I'm sorry to tell you, there's no embryos. Okay, bye. There's no viable embryos. I'm like, okay.
Yeah.
So all this work that we did for a couple months, like here we are, like having to start over again. And it's really difficult. So I think a lot of mental health issues are going undiagnosed in these spaces. And I wish there was more kind of addressing that. And even a great example is like, if you have a patient, this is more for clinicians or the offices, if you have a patient that's calling every day, like trying to make sure that they're taking the right, like they're not annoying.
Yeah.
I mean, I'm sure you're annoyed by the constant, like, just take the medication at this time. But that to me is like, that's someone who's really anxious.
Yeah.
Like they are struggling.
Yeah.
No one would call you every day if they weren't.
Right.
So it's kind of trying to, instead of like dismissing it as like, oh God, she's calling again.
Right.
To be like, oh, she may need more support here. What can we do?
Yeah, we have no idea what support or lack thereof of support that they have at home. So that might be it.
Yes.
Yeah.
So that was convoluted.
No,
if it's covered by insurance, go there because that's the best thing for your finances.
Yeah, no, I guess I was more thinking of like if there's a checklist or something of things that you should make sure clinics have or red flags maybe, or I don't know.
I don't know. There's a lot around this. Like I always was like, is the lab here on site? Because like I always was scared of like my embryos being transported somewhere and then getting mixed up.
Yeah. That's like a destination unknown fear.
Exactly. I was like, I need my embryo. I need to know where they are.
Yeah.
It's like, no, you don't. You don't actually need to do that.
Yeah.
But that's
have a chip in it.
Yeah, exactly. I need a tracker. I need a tracker to make sure that that's mine.
Yeah.
But other people aren't that worried about that. I was very worried.
I would be.
I was like, are you sure it's mine?
Yeah.
Because pregnancy is really hard to carry someone else's baby if you're not a surrogate, right? If you're not doing it anyway.
Yeah.
So, I think, what I wish actually, that there was more regulation.
Yeah.
That's something that's not about the clinic that you go to. Their results are published in terms of how many live births they've had. And so that's good to look at. Also, make sure you do a little quick Google search that they haven't switched embryos. You don't want to go to that clinic.
Yeah.
Probably best not to. But generally, more regulation, more information.
Yeah.
I think I want people to know, yes, freezing your eggs can be an insurance policy, but it doesn't necessarily mean that it will be successful.
Okay.
And I think too many young women are spending a lot of money doing this, thinking that it's for sure.
Yeah.
But we don't know if embryos will be viable until the egg has met the sperm. Right, until it's an embryo. We can't actually tell how good an egg is on its own. They can look at it and but we don't actually know until it's mixed with sperm.
There's no way to test it prior. Okay. Well, we had one person write into saying, and they felt like they were having sex purely for trying to conceive.
Oh, yeah.
So what suggestions do you have to avoid this? And then how can they kind of keep it pleasurable and exciting, because sometimes it can go on for months.
And just start to be like routine, like, hey, I'm ovulating.
Right. It's time. Like,
I know.
That can kind of run out.
That does become this weird thing where you're starting to have sex for like a purpose and you didn't before. So I think with this, it's really important to understand more about your sexuality. And sometimes couples aren't having these conversations but in the postpartum, it'll really matter. So if you can start now, that's fantastic. Of really kind of looking in, being like, what do I like? What kinds of things turn me on? For women, generally, that happens outside of the bedroom. That's something that happens more with your brain. And so do I want to go on a date? Do I want touch? Do I want, what is it, the things that kind of build up for me, my sexual interest? And really talk to your partner about that. So instead of just saying, hey, we got it, plan a date. You know when you're going to ovulate. So plan something that you guys are, where you can be together, where you can have fun. I mean, obviously, if you have children, get a babysitter and try to do those things that connect you outside of the bedroom to really bring it into the bedroom. And I think with sex, the most important thing is to maintain curiosity. So maybe you're doing this routine, but maybe it's time to explore some new things or things you haven't tried. So again, being curious about what you're interested in and talking to your partner, how is this feeling for you? This isn't, or just being real about what's going on. Want to try something else? Should we go to a hotel? Like what things could kind of make it a little bit more exciting? But I always think like the intimacy outside the bedroom is really important, because especially when you're struggling to conceive, or you're like, we've been trying for 6 months and this still isn't happening. I think there can be some built up resentment, and talking about that and like being connected emotionally, I think can help with the connection with sex.
Yeah. And I think it's tough because, I mean, if you're in male-female relationships, you go your whole life avoiding getting pregnant, and then all of a sudden you're expected to do the complete opposite.
That's right.
And even I would think that there would be fear in that too.
I know. And what's really,
if that's the goal, right?
Right. And what's fascinating, right? So it's really goal, like, there's this performance thing.
It goes from goal, not get pregnant, to goal,
yes.
Let's try to get pregnant.
People that haven't gotten pregnant because they've been so good at using different forms of contrast are like, okay, now I have to achieve this. There's like an achievement mentality, which I think is really challenging.
Yeah.
And there's also the myth that we hear of like, oh, if you look at someone of the opposite sex, you're going to get pregnant.
Yeah.
And it's like, no, that's actually not how it works. And it's even learning. People sometimes don't know about ovulation.
Yeah. Yeah, I think that's at Natural Cycle is one of the things that people of all ages that follow us are so shocked when we share. We usually share it some kind of post, whether it's slapped on a billboard or something, where you can't get pregnant 24/7 because for whatever reason, we all had sex ed, but yeah.
But it's very fear-based.
Oh, totally.
It's fear-based. It's bad things are going to happen. Yeah. And I think we maybe need to kind of change that dialogue early on, because then it puts so much pressure of like, well, I was supposed to get pregnant like no matter what, and now I'm not.
Yeah. Yeah, it's that, and then also you realize then how difficult it can be to become pregnant, and it's not this 24/7 thing that you grew up maybe thinking or believing.
Yes.
But yeah, it's definitely fear-based.
And there's also something of like, this makes me a woman, right? There's also this like connection to womanhood, and this is natural and it should just happen for me. And so I think that there's a lot of grace that we need to give ourselves, especially when things are not going, as planned, and it's happening for a lot of people. It's because we're delaying childbirth. Because we're able to have now careers and decide to have babies in our late 30s instead of in our early 20s. But, there's also some other factors, whether it's, toxins or environmental issues, like people are struggling to conceive a little bit more.
And then I guess in kind of with sex education, having kids, how do you feel about having those conversations so that they're not 30 and then realizing for the first time you can't get pregnant 24/7, because it sounds crazy as somebody who's in this field, but for a lot of people, especially with social media, how I'm managing that, I'm seeing those aha moments of a lot of our followers who are well into their 30s who didn't even know that they weren't having a period on the pill.
I know. And what's really fascinating is it's like high literacy people.
Yeah.
It's like everyone.
Yeah.
It's not just people that it's tragic.
Is everyone.
Yeah, it's everyone. And I think with that, we just need to, and I think we're starting to do this. I've seen like my generation of parents using, the biological terms for genitalia, for how things work.
Yeah.
Even I was explaining to my 4-year-old what sperm was the other day. Yeah. And my husband was
like, no more birds and bees.
What? Like, what's that? And I'm like, well, he's asking what's in his scrotum. So like, what are we going to talk about here?
Right.
And calling things by what they are. And I think that's going to get us sort of closer to where we need to go. But no, I think we need to explain, what's going on with your cycle when you first get your period, what's happening there.
Yeah.
And that there's a lot of education needs to be around that. I mean, people are like, well, how long is your cycle? It's 4 days. I'm like, no, it's not.
Yeah.
It's your period.
Right. Yeah.
Right.
Yeah. It's one part of it.
Right. Exactly.
And then I guess for kids too, and I know there's probably not a timeline, but when you're speaking with patients, how do you communicate when somebody, if they're unsure if they're ready to have another kid? I know there's there's not, okay, 20, 20
No.
months after you're ready.
No, I know. Well,
whatever,
there are some like safe. Some of the evidence, again, it's not built on that much. Is like 18 months between pregnancies. I mean, I had 2 kids 13 months apart, so I did not listen to that advice, and they're fine. I think it's so individual.
Yeah.
I think this is like you need to check in with yourself, with your emotional bandwidth, with how much support you have, how much financial resources you have. I mean, we need to think about all of these elements. And I'm an only child.
I am too.
Yeah, I have 3 children, but I also think having an only child is an incredibly valid choice.
Yeah.
And it can be wonderful. I don't know how you feel about it. I think it's harder as I'm older, actually.
Yeah, I mean, there was definitely rainy days as a kid that I wish I just had somebody to play
I
with
know,
or something
I
like
know.
that. But yeah.
Well, I had
think-
my imagination,
Yeah, totally.
but I hear what you're saying. I think,
I was a young adult at 4.
yes,
Like you
me too.
definitely mature.
Yeah, exactly.
A lot
faster. I think my mom getting sick recently has been really hard. That there's no one else to be like, hey, can you go to the hospital?
I do think of that. Yeah.
That's tough. But I think that you just have to check in with how you're doing and your bandwidth always. I know it's really hard, especially when all of your peers are like, maybe you have a child the same age that's now 3 or 4 and they're all having babies again. But I think check in with yourself, check in with your partner. It's not for everyone. Families can look so different.
And if you are planning to expand your family,
Yes.
how do you have the conversation with the children that you do have?
Oh,
'Cause
yes.
That's a huge
Yes.
step
For my
too.
first, I didn't have to have any conversation. And it's so funny, like my 2 boys that are 3 and 4, like my 4-year-old doesn't know life before, I don't think, a sibling.
Yeah.
But how do you talk to them? I think, it's difficult because you want to make sure that it's consistent and it's going to stay. But I think share when you're ready. And some people are afraid to share too early because of loss and how they would explain loss. But listen, loss is part of life, and we have to figure out how to talk to our kids about uncomfortable, difficult subjects. And I think it's a great place to start if that's, and that they're going to have a sibling and what it's like to share and what it's like to, but there's always room to love all of them, which is what I found. I couldn't imagine how that would be. My mom is still like, I don't understand how you can have more than one child. Like, how do you expand in that way? And you just do.
Yeah.
It just happens
You always
naturally.
do.
I would say that, if there's something in you that says, this is it for me, I don't think I can do more. I think really tap into kind of what that means for you. Because I think sometimes people are stigmatized for the one child, like, choice.
Yeah. And then I know you spoke a little bit about people who choose not to have children.
Yes. We don't talk enough about them.
No. And I guess I'm curious, as your friends continue to have children and you then get closer and closer to physically not carrying your own, I would imagine there is a period of maybe some depression, even if it is a decision that you've made fully with your whole chest that you do not want to have kids.
I think, obviously everyone has different experiences, but the one that I seem to hear a lot is that, sure, there are times where you reflect on what could my other choices have been. I mean, I reflect on, what if I had 2 children? What if I had 1? What if I had 0? We're all looking at like maybe the path we didn't take.
Yeah.
But ultimately, I think it's really important to remember that meaning is not constructed just from having children.
Right.
And if that's where you're getting all of your meaning, that may pose some difficulty when your kids do what they want to do.
Yeah.
Because they are not extensions of you. They are separate people. And so I think ultimately, if you're making meaning of other things in your life, and I think you don't have to be a mother to mother. You can be a mother or have those kind of feelings and that with your friends. You can have it with your nieces and nephews. Like, there's so many other ways to kind of be a mother that I think you can get those feelings. It's not the exact experience, but I think that there's something there. And again, making meaning and purpose is so varied and so different.
Yeah, I do think there's something to be said about feeling confident that you would be a good mother, but choosing not to be a mother.
Yeah, that could be something you do, but it's just not something you want to do. And there's so many valid choices Yeah, to not do it. Those double incomes sound nice.
Yeah.
What is it, Dinks? Double income, no kids?
Yeah. We talked about that. Or there's something with a pet too.
Oh, what's that?
But it's like another acronym. I won't even try to say it.
But even when you have a pet, you're parenting, you're mothering. Yeah. There's those like really strong emotions. So I don't think that just has to be from having a biological child or an adopted child.
Right. No, totally. And then I guess to pivot back to pregnancy, how do you navigate the changing hormones throughout that? And I'm sure that is a varying degree.
That's hard.
Yeah.
And it hits everyone kind of differently, maybe at different times in their pregnancy. I think this is with a lot of support. And, I love when pregnant people start connecting with other pregnant people, because it's like, oh, are you having this? Are you experiencing this? Again, that community, that social support is what's so important at the core of all of these things, whether it's infertility, pregnancy loss, or the postpartum, connecting with the people who are having these issues. Also, using natural cycles so you can write down all your symptoms and share them with your doctor is extremely helpful. There is support. You're certainly not alone in this.
Yeah, it's nice now because people can just opt in to download a PDF of those symptoms and show up with a printed piece of paper.
I still haven't had that. I need my patients to do that.
Yeah, I'm notorious for I'll go in with questions in my head and then
forget them all, right?
So
but this is
nice
a really great way of be like, no, here's some objective, like here's my cycle, here's my mood during my cycle, and you can really help your doctor diagnose and kind of help guide your treatment.
Yeah. All right. Well, this was awesome.
This was so great.
Thank you so much for your time.
Appreciate it.
And
awesome.
we're so excited to have you on the medical advisory board, and thank you again.
Thank you so much.